Good afternoon, everyone, and thank you for being here today. My name is Sam Silva, and my colleague James Collins. We will be conducting this brief educational event about the Medicare and Medicaid and about the controlling and authority body, which is a CMS, as you can see on the screen right now. The CMS regulates the health plans and details about the products in the industry. And the short form is it's a Center for Medicare and Medicaid Services. Moving on to the next slide. The second slide shows you the image of the cards. Most of you are aware of the card on the left, which was the old Medicare card, and then the new Medicare card, which they launched it in 2018, March, April. Now everyone has received the new card. If you still have not received the new card, you can call 1-800-Medicare and then request for a new card. That will replace your old card. The new card, the significant difference is the number. The Medicare number has been uh, up, upgraded or updated on the new card. It doesn't reflect your social security number as it used to on the old card. So because of that, the new card is much secure and it doesn't compromise your personal information. Um, in um, in short, the Medicare is a federal health insurance program for people 65 and above and people with certain disabilities. So once you once you become 65, you're automatically entitled to your Medicare benefit. And in line with that, the HIPAA is the law and regulatory body of the health industry, and most of all health-related personal and identification information. So if you know HIPAA, if you follow HIPAA, it's like the federal law of the industry. So you are very well knowledgeable on the health and Medicare. In connection to that, PII, personal identification information, and PHI, personal health information, which are subcategories which are more also important factors when we deal with the Medicare market. MACRA is a 2015 Resolution Act called the CHIP Resolution Act. It allows the industry to advance into a more technological friendly and accurate environment. Things like merit-based incentive payment systems and with along with Macra, a lot of improvements has been happened in the industry where the people were able to synchronize their information freely and access to information, security of information, and so on. Similar to what with the Macra came along in 2015. which will highlight on the next slide. You can see the blue health button, which is a free and easy app, and also um, hello, that's another app that you can record your health information and keep it handy and hand it over to your doctor through a QR code on your phone whenever you visit a doctor or clinic. So it's a handy health record information which is encrypted in your own device. And also you can use the GoodRx, which is a discounted pharmaceutical program, and you can actually use this in conjunction with your existing prescription drug plan or a health Medicare Advantage plan through your health provider, which gives you extensive benefits and extensive discounts on existing drugs. Could cut down your cost of your drugs by up to 85% or maybe 90% sometimes. It's a really good free program. You can sign it up and you can download this app on Google Play or um, Apple Store, and then you use it at a pharmacy. Moving forward, this is the Medicare card. Most of you are aware of what the card is look like, but some of you are not aware of what this A and B is for. A is for hospitalization, B is for doctor visits. It's called the outpatients doctor visits. And moving forward, uh, well, the original Medicare, as I mentioned earlier, it's a federal program which only covers up to 80% of the medical cost. For example, if you are admitted to the hospital, you are liable for $1,408 deductible before any of the original Medicare benefit kicks in, and thereafter you have to pay 20% of the remaining bill of the hospital. Could be a very extensive amount, and it could cost you thousands and thousands of dollars. And that's why the original Medicare itself, it's not a recommended plan, because you are liable for unlimited costs. There's no safety net, and you have to pay a deductible 20%, plus you will have to pay certain co-insurance after 61 days to 90 days. And also beyond that, you pay a larger co-insurance rather, $704 with original Medicare. And also the Part B, the outpatient, you have a deductible of 144 and or higher. 144 is your Part B premium, and Part B deductible is 198 for the 2020. This could rise up, as well as this could rise up in 2021. So this is the what the original Medicare offers. It doesn't covers you 100%. It doesn't cover you for prescription drugs. That's why we always recommend anyone who's turning 65 and obtaining their Medicare eligibility, which is a good thing, but that plan does not cover you 100%. Go into Advantage plan with a 0 monthly premium, and you don't have to worry about any of these deductibles or 61 to 69 90 days co-insurance and so on, so because the plan is very well structured. There's no deductible, there's no co-insurance. There may be a co-payment like a $10 and $20 when you go to see a primary care or a specialist, something like that, or could be a little bit higher. So that's the recommendation. And moving forward, about the original Medicare, it doesn't also cover some of the items, services Medicare doesn't cover. Includes long-term care is a different subject, but most dental it doesn't cover. Eyes doesn't cover. Dentures, cosmetic surgery, acupuncture, these are not covered under the original Medicare. However, these can be covered under a health plan such as Advantage, Complete, or Supplement plan. Next, further expanding on the Part A, hospitalization, which helps inpatient, skilled nursing, hospice care, and home health care. That's with the original Medicare. And then the Part B, which is a medical component. And you can add a Part D, which is a drug component, which is something you have to purchase separate. It doesn't come with the original Medicare. You have to pay for this in addition to your original Medicare benefits to obtain the Part D drug coverage. And when you talk about options, there are two options to fulfill the gaps of your original Medicare. The option one, as you can see, it's a Medicare supplement option. It's also called the Medigap plan. It's basically fill the gaps of original Medicare, the deductibles, co-insurance, and 20%, and it gives you full coverage incorporated into the gaps of your original Medicare, meaning that you can have this policy as a supplement policy in connection with the original Medicare. So, like original Medicare, the supplement plan does not have any additional benefits other than it covers the gaps. And because of that, you need to add a standalone prescription drug plan, which is a Part D plan, into option one with a supplement plan. Could be a little bit expensive option, but it's a burden-free option if you're looking to have a flexibility and free out-of-network visits and things like that. But also the option two, which is a most favorite and recommended option because it covers you from top to bottom, and it doesn't cost you as much as the option one. Most of the time, there are plans with the zero monthly premium. The talk about option one. The option one combines the A, hospital, B, medical, D, prescription drugs into a one single plan called Medicare Advantage, also called the complete plans. So it combines A, B, and D into C. That's what you what calls the C. A lot of people are asking about the C. What is C? So now I think I have kind of clarified that it's a combination of A, B plus D, and it gives you area of benefits, bells and whistles, from hospital coverage, doctors, prescription, and it has an additional benefits such as dental, vision, food care, gym membership. Some plan even offers you a OTC card, which that you can use at a pharmacy for over-the-counter essentials. So this is one of the favorite options of most of my clients, as well as my favorite options in terms of saving money and getting a very, very good coverage. Moving to the next slide. This is what the part fours of Medicare, A, B, D. Now you see the plus sign here. That's mean you add A, B plus D equals C. That's what's the meaning of this. The picture shows you right now. It's the combination of A, B, D equals C. Usually the C's are the advantage or the complete plans. Moving further, open enrollment period is the period that where you can change your plans numerous amount of time. You can switch from one plan to another. You can switch from advantage plan to a supplement plan. You can switch from supplement plan to advantage plan. You can switch from advantage plan to another advantage plan, or you can purchase the prescription drug coverage or change your prescription. Everything can be done during this period of time, which is 15th October to 7th of December. It doesn't necessarily mean your plan starts during this time of the enrollment period. It tells you open enrollment, meaning open to enroll. So it doesn't, your plan only starts on 1st of January. When you enroll during this open enrollment period, your plan starts in 1st of January. That's what the open enrollment period means. The second type of enrollment period is called the open enrollment period number 2. It's also called the individual MAOEP period, which stretch from 1st January to 31st March. During this period, you are allowed to change any prior advantage plans that you have taken to another advantage plan, or drop your advantage plan, go to a original Medicare and take a prescription drug plan as a standalone drug plan during January, February, and March. That's the changing period. So if you change in January, your plan could start effect from February. If you change in February, plan could start effect from March. And if you change in March, your plan could start effect from April. So that's how the open enrollment period works during these 3 months. And after March 30th, you're not allowed to do any changes. It's a one-time change that you can do in this time of the year. Also, moving forward, it's a general election period for people who have not taken your Part A or B. You can re-enroll through Medicare or Social Security to obtain your eligibility of A and B, and then once you do that, you can start your plan as early as 1st of July. So that's the second OEP period for your Part B election. So it starts on 1st of July. So that's the effective date that your plan can start. Initial enrollment period, which is a crucial and vital part of your initial enrollment into a Medicare plan. When you receive your Medicare card, and that card will be effective from the first day of your 65th birthday. Like the 65th birthday, this is a very important election. As you can see, it's highlighted as a 65th birthday. And 3 months prior to your 65th birthday and 3 months after your 65th birthday, within that window of 7 months, you have an election to enroll into a Medicare plan, Medicare Advantage or Medigap, supplement plans, any of those plans. So if you miss the election, there's no other election for you to enroll into a plan other than if you have a special valid election, or you have to wait till the annual enrollment period to enroll into a Advantage or complete plan. Supplement plans are quite different, but supplement plans, you can avoid that requirement of underwriting during this initial enrollment period, because there is a clause that does not allow many insurance companies to do underwriting during the special initial enrollment period. So I would suggest you take advantage of this and get a plan as soon as you turn 65 and as soon as you receive your Medicare card.
Okay, your Part B penalty. If you didn't get Part B when you're first eligible, your monthly premium may go up 10% for each 12-month period you could have had Part B, but didn't sign up. In most cases, you have to pay this penalty each time you pay your premiums for so long as you have Part B. Down there at the bottom, you see an example. If your enrollment period ended December 20th, 2020, you waited to sign up for Part B until March 21st, the general enrollment period. Your coverage will start July 1st, and Part B premium will 20% of the standard premium. You'll have to pay this penalty for as long as you have Part B, so it's going to cost you more money if you don't get Part B when you're eligible.
In conjunction with the Part B penalty, this is called the Part D late enrollment. This usually happens when you lapse 63 days, a gap from the time of you lose your employer coverage and you did not obtain a drug coverage, and you only have the original Medicare A and B, and you did not obtain a drug coverage within the first 63 days of losing or being eligible for a Medicare plan. That will apply a 1% of the national base beneficiary premium. In 2020, it's $32.74, and it'll be up by it'll be $33.06 in 2021. So it's a 1% of the national base beneficiary premium that will apply to when you enroll in Part D plan, when you did not enroll in a plan as soon as you are eligible for Medicare. So this it can be avoided by enrolling into a Part D plan. Usually, some people are automatically enrolled through the administration to avoid the penalty. But when you enroll in a Part D plan, keep in mind that all Part D plans has premiums which are anywhere from $30 to, could go up to $60, $70 a month. That's just for the Part D. But if you take a complete plan which already have inbuilt Part D benefit, then you don't pay a premium. It's already been sponged into the plan by the plan. So if the Advantage plan has a zero monthly premium, that's mean you're paying zero for your drug monthly. So you are getting a free drug plan in an Advantage plan. That's why we are very keen on promoting the Advantage plans. It gives you an array of benefits of all the bells and whistles, and that's what it is. I would recommend not to wait or have any gaps on the Part D, not to be penalized with the 1%. It could add up. Really, the calculations are such complex. I cannot give you an exact figure. It could be, 10 cents added to your monthly Part D premium, could be 50 cents. Now, it's something in that range. There's no exact figure, depending on how long you have been without the coverage. So, yeah, moving forward on Part B, uh, which is uh, which is that. And the choice of Medicare Advantage plans, health maintain organization. This is the most famous plan, and now they have the PPO and HMO combinations on the most plans, which is a great feature. You can go out of the network with the PPO. PPO meaning preferred provider network, HMO meaning health managed organizations. So it's a pretty much the similar type of things, but HMO is network based. PPO meaning you can go to any preferred provider that's outside of network. And the PFFS, private fee for services plan, these are work as more like a supplement sort of a plan, but I'm not going to go into details. Very confusing. I can give you more details on these plans if anyone interested in knowing and about the plan in specifics. And this is what you can do. You can purchase Part D Medicare prescription drug plan as a standalone, or you can get a Part D as a part of a prescription drug plan as part of an Advantage prescription drug plan, MAPD, which is a most famous right now. A lot of people are in this plan. I recommend a lot of people to enroll in this type of plan. All Medicare Advantage plans provided by the private insurance companies has to meet the minimum coverage set by Medicare, which means the original Medicare benefits that the original Medicare provide has to be catered by the health care companies. They cannot give you any benefits less than that. But right now, all of the healthcare companies are giving far much better benefits than the original Medicare. It has exceeded the original Medicare benefits. This is the advantage of Medicare Advantage plans. As you can see, the Medicare Advantage plans has all this coverage, whereas the original Medicare only has these three coverage. It's only cover hospital stays, not 100%. It covers only 80%. Coverage for some medical care like doctor visits, it's only cover 80%. The original Medicare. Preventive services like flu shots, covered by original Medicare, that's also up to 80%, but some instance they cover full 100%. But overall, as you can see, it doesn't have prescription drug coverage, routine vision, routine hearing, limits on annual out-of-pocket cost. That's meaning there is no safety net. And these plans has everything. These plans cover 100% on coverage for hospitals, doctors, flu shots, prescription drugs, routine eye, routine hearing, and there's a safety net which called the out-of-pocket maximum, meaning that any single given year you will only be liable for aggregated amount of set standard of out-of-pocket maximum. For example, if the out-of-pocket maximum is $3,400, if you spend $3,400 in co-payments, co-insurance, and things like that in any single given year within before the year ends or close to year ends, and then thereafter you're not spending a single cent on any services, meaning there won't be any co-payments after that. So that's a safety net right here, which is a great feature on these Advantage plans. That's why I recommend everyone to have this plan, which is safeguard your out-of-pocket expenses. A little bit more stretching for the plans and how it performs. 24 million people enroll in Medicare Advantage plans as of 2020, and 93% are satisfied with the benefits and the features and what the plan offers. 20% spends on healthcare compared to original Medicare. So that's what's Advantage give you. It gives you a lot of advantages based on these benefits right here. Moving forward, this is what's the original Medicare card look like. It has your name, has your new Medicare number, which is an alphanumeric. It does not contain your social security number. It's safe to carry it around because nobody can hack this number and try to get into your personal information, because this is encrypted. Part A is the date that your hospitalization benefits start. Part B is the date that your medical benefits starts. Most of the time, these dates are consistent, but sometimes it changes depending on when you receive Part A and when you receive Part B. If you receive Part B later time, then this will reflect at a later year, and this will reflect at a earlier year. So that's how the original Medicare looks like. And as you can see, there's no gender specifications on the new card. They have taken it out, probably for the political correct reasons. So they have not included that in the new cards. All right, so these are the most important stuff that you must know. If you do not have a Medicare account, I will suggest you create one, and this is the way that you can create it. I can send this information to anyone who interested. I can send it to their email addresses with the specific instruction on how to go step by step. But as you can see, this is what the face page will look like. You have a login, you can log in. If you don't have one, you can create one. You need to know your Medicare number and such in order for you to create an account. If you don't have a Medicare number, if you don't know your Medicare credentials, if you have not received it, I suggest that you go into the Social Security site, which is another good, valuable site that everyone, not only seniors, anybody who's 18 and older should have a Social Security account, because it can track your annual contributions to your Social Security and Medicare when you pay taxes and things like that. So if there are any lapse or any changes or any errors, you can freely check these accounts and then inform the authorities. So it's good to have. If you have an account, you can log in and if you don't have one, you can create an account. And then once you create an account, you can freely see all your information. If you're a Medicare a recipient, then you can see your Medicare information in the Social Security account. If you don't know your Medicare number, you can obtain the Medicare number, and once you obtain the Medicare number through the Social Security account, you can go back to the earlier sites I was referring, and then you can create a Medicare account and then obtain the benefits and see what are the deductibles, what are the Part B payments, and how much you're receiving as your Medicare benefits. And things like that. And on the Social Security side, you can also see your Social Security benefits, your retirement benefits, and things like that will be displayed in this account. So it's a very valuable information. Anybody who would like to keep your information intact and free and easy to access through a simple website. It's a secured website, so there's no risk in this. And next is the Part B. Anyone who has not signed up for Part B, now since the COVID has affected entire industries and people moving and doing things in person, though the Social Security Administration has come up with online applications. It used to be in person at the Social Security Administration, but now you can fill this up and send it out directly to them through mail, and then apply for your Part B benefit. Like I said, there is a general election period where you can apply for your Part B benefits unless you have another special election. So you can fill this up and send it to Social Security to apply for your Part B benefit. That's what this form is for. This is electronic form. You can go to this website URL and then fill it. Thank you everyone for being so patient and being wonderful audience during this presentation. I hope you have learned a little bit about what's Medicare and what will help you in deciding which route to go. If you have any concerns and questions or need to talk to somebody to find out some little things, give us a call, give me a call anytime, and my number is listed on the screen and as well as my website. I do have a live chat session on the website. That's the easiest way to reach me in case you couldn't get through to me on the phone. And that concludes our presentation, and I will pass this to James for his introduction. Uh, Thank you.
Hi, my name is Jim Collins. I'm an insurance agent. I've been in insurance for 15 years. Me and Sam work together. You have my number there on the website. It's collinsinsurance.com. There you can get anything you want. Health insurance, life insurance, vision, dental, accident, Medicare. You can get it all. So like I say, give either Sam or myself a call. We can help you out.